Hari Om and a very hearty good morning to one and all present over here. Today we are residing in the 21st century, but I am talking of an era in the 19th and the 20th century. A day in 1990 saw a large number of 20 lakh deaths around the world. Among them, 79% deaths were due to a certain disease. And this disease that had wreaked havoc around the globe and among all nations of the world was malaria. Malaria, or the plasmodium caused disease, which was reported to have come from mid-Africa and Central Asia in around 1750 to 1780 during the time of the Industrial Revolution, wreaked havoc, and the WHO under the UNO was bound to make it a global disease in 1990. The day was 1991. The UNO General Meeting and the WHO General Meeting was happening for the first time simultaneously and parallelly. At this time, it was proposed by Nazima Fateh that this day of 25th April, that is today, this day to be celebrated as Malaria Day or World Malaria Day towards the world and around the globe. This was to create awareness of this deadly disease that had produced numerous deaths and many active cases around the globe. Malaria in India has been an endemic, an epidemic and a pandemic disease in 3 different cases. In many areas it is an epidemic disease and in some areas it is endemic to that area. An example of a state in which this disease is epidemic in nature and in some places is endemic in nature, both diversifically, is Odisha. It is my home state. My home state Odisha boasts hilly regions, forest and forest-fringed areas as its chief cultivation of this malarial-borne Anopheles mosquito which borns the disease in its blood. This plasmodium-caused disease spreads mainly through the bite of the female Anopheles mosquito, which is found in plenty and in bountiful about the Plasmodium falciparum virus in many regions of Odisha, mainly Koraput, Malkanagiri and Mayurbhanj, the forested regions of Odisha. Odisha accounts for 11% of the total amount of malaria cases around the country. So there have been steps that have been taken by the state government to tackle this situation in the state of Odisha. Some of these measures are: the long-lasting insecticidal net has been introduced in each and every home for better inoculation against this deadly virus, this deadly plasmodium-caused disease. Next, ICE, BCC and IPC are the 3 methods that are taken to prevent malaria at the growth stage. Many insecticides are spread about once a week by the local municipal corporations to tackle the mosquito-borne diseases and to kill the mosquito larva at the larva and the pupa stage. The next one is, once the person gets the disease, there have been numerous ways in which the disease is treated. The most common way is by using and administering the drug hydroxychloroquine. But for more effective study and for more effective management of this disease and for curing the disease, we do not use hydroxychloroquine as a drug for this disease. In our district of Sundagarh, Tensa, Bansua are mainly endemic to this disease. In these areas, we may use hydroxychloroquine due to the presence and evidence of cinchona trees found in those regions. But in most of Odisha, we use direct doctor observation treatment or draught treatment to treat the malaria patients. They are also treated as under doctor supervision care or UDSC, direct care treatment to treat malaria patients. Malaria patients may develop shivering, which is controlled in Odisha due to the falciparum type of virus and the falciparum type of plasmodium that is mainly found in the hilly regions of Odisha. Our ASHA workers around the state have been taken to tackle the fever transmission doctor protocol or FDDP to tackle the malaria measures and to prevent shivering and fever around the malaria patients of the state. There have been also many measures to tackle this situation by initiating the Daman initiative and the Daman scheme, which helps the malaria patient to be treated free of cost at any government or private institution or any government or private hospital. This has bolstered the effect of Odisha's malaria tackling situation, and the number of malaria cases dropped from 20,000 in 2017 to 16,000 in the year 2020. It has further dropped in 2021, even though we saw a steep rise in cases in December, but the situation is now under tackle. So this has been the scheme of Malaria Drive. This year's theme for World Malaria Day is Harness Innovation to Tackle Malaria Burden and to Save Lives. So let us now pledge ourselves to be aware of this deadly disease and to protect ourselves and our family members, our near and dear ones, and in turn save a social affair and to save the country from this deadly disease by being aware of it, by taking the necessary precautions of killing the mosquitoes, by using mosquito nets, etc., so that we can tackle this disease only at the early stage, and early diagnosis can help to tackle this disease from eliminating in the state and to help the state become totally free from malaria in the years to come. Thank you. Have a nice day ahead.
Hari Om. Om Chinmaya Sadguruve Namaha. Every year, World Malaria Day is observed on April 25th to create a global awareness of the disease named malaria. Malaria has a devastating impact on families, communities, and societies. Though it is a preventable as well as treatable disease, it has created problems for the health and livelihood of people across the world. The World Health Organization is playing an important role by asking for investments and innovation to be made in new vector control approaches. This might help in diagnostics and producing more anti-malaria medicines and tools to speed up the pace of progress against malaria. The theme for this year's Malaria Day is Harness Innovation to Reduce the Malaria Disease Burden and Save Lives. In the year 2020, there were an estimated 241 million new cases of malaria and 6,27,000 malaria-related deaths in 85 countries. More than two-thirds of deaths were among children under the age of 5 living in WHO African region. This day is dedicated in spreading the awareness about malaria and how can we prevent the disease. In the famous words of Bill Gates, the malaria parasite has been killing children and sapping the strength of whole population for tens of thousands of years. It is impossible to calculate the harm malaria has done to the world. This day is marked with activities organized by malaria-affected populations, governments and private organizations all around the world to raise awareness regarding malaria, preventive measures and treatment choices. Anti-malaria bed nets are on display and being given to the public in certain nations. Aside from that, anti-malaria medications are distributed to those who reside in filthy or malaria-infected regions. On the whole, let us hope that one day we are free from malaria. Hari Om and thank you.
There are more people dying of malaria than any specific cancer, said by Bill Gates. Hari Om. Myself Manyata Linka of Standard 10D. I am going to recite a small poem bearing the title Malaria, a Dreadful Disease. Malaria is a dreadful disease making human life cease. Malaria is a dreadful disease making human life cease. It's caused by mosquito bite which acts as a harmful parasite. Does the life that's bright, leading to death and life fight. Does the life that's bright, leading to death and life fight. Symptoms begin after 15th day, using our immune system as its prey. Mosquito saliva travel into liver and reproduce. Deadly reactions it induce. Use mosquito net to escape from the threat. Use mosquito net to escape from the threat. Drain the standing waters which are malaria promoters. Follow proper mosquito control to save your soul. to save your soul. Thank you.
A very good morning, friends. I am Dr. Deepak Kumar Das, General Surgeon by profession. I am here today in front of you to spread awareness regarding a very burning disease, that is malaria. As we know that malaria is a very severe disease. It is an endemic disease but completely preventable and curable if detected in time. But somewhat this disease was ignored or awareness was not spread during this COVID pandemic times in the last 2 years. But worldwide 241 million cases were seen and 6 lakh deaths were recorded on paper in 2020 alone. So this disease has not disappeared. As we know, World Malaria Day is on 25th April this year, and the theme of that Malaria Day is to harness new innovative ideas for malaria control. What is malaria? Malaria is an acute febrile illness. That is, its first symptoms are fever, headache and chills. It is spread by the bite of female Anopheles mosquito, and the parasite is Plasmodium species. What is the at-risk population? The at-risk population are you, that is children, pregnant mothers. But I will go into the prevention of the disease, which is essential for you all. How can we prevent malaria from spreading? First is to prevent the mosquito breeding itself. That is, anywhere you see stagnation of water, anywhere you see open water being kept, water coolers, tubs, pools, they should be covered or insecticide should be sprayed on them. Water stagnation should be prevented at all costs, because mosquito bites do not only spread malaria, also other diseases like dengue and chikungunya. Next is how to prevent mosquito bites. Insecticide sprays should be used and nets should be used. Here two innovations are being promoted by WHO, that is insecticide treated bed nets, and residual indoor spraying of insecticide should be done in all districts. Next is how do we prevent the entry of mosquitoes into our homes. That is, windows and doors should be sealed and net should be applied on the windows. And last and all, if any of you get any symptoms at any time, then the nearest health center must be contacted, or your ASHA workers. The primary level must be contacted at once so that treatment can be started as soon as possible and the disease does not go into a severe stage. So my message for you all is we should work hand in hand to prevent this disease from being spread and to make India malaria free as soon as possible. Thank you so much. Let us promise each other that we will make India malaria free. Thank you.
हरिओम मु श्री अनुजा दशम श्रेणी गह विभाग छात्री विश्व मलेरिया दिवस अवसर रे एक छोट कविताटी आवृत्ति करने को जाऊँगी। आशा करे आपण मान समस्त को यह निश्चय भल लगे। मलेरिया एक भयंकर रोग व्यापी थाए मशा जोगु। झर न छाड़ी देह हाथ बिंधा होई थाए एहा जोगु। मशा वंशवृद्धि रोगर कारण अनेक कारण मध्य रोगी पाए कष्ट हुए अंतसंत यार प्रभाव जोगु रोगर लक्षण वृद्धि पाई थाए 15 दिन गड़ी जीवा परे रोगर जीवाणु वंश वृद्धि करे शरीर भितर सुस्थ कोशिकार भक्षण पर आगक माड़ी चले रोग करी रोगी को दुर्बल चली न पारई बसी न पारई देह हाथ बिंधे प्रबल तुरु तुरु होई रोगी कंप थाए घोड़ा घोड़ी होई कंबल जीवन युद्धरे हारी जाए रोगी न पाइले उत्तम चिकित्सा आगकू माड़ी चले रोग कर नहेले प्रतिकार व्यवस्था वर्षा ऋतु रे बढ़ी चले मलेरिया प्रभाव परिष्कार परिच्छन्नता चारिपाखे रखी करी हुए बंचार उपाय दूर करी हेब मलेरिया रूपी यही भयंकर बीमारी जेबे हेब आम सभींकर संपूर्ण रूपे भागीदारी मशा हेउची यही बेमारीर घर चाल समस्ते मिसे करवा यहाकू दूर जन समाजर हेउ यह चिंताधारा मलेरिया मुक्त हेउ आम देश सारा मलेरिया मुक्त हेउ आम देश सारा दूषित जल अपरिष्कार स्थान इत्यादि चाल परिष्कार करिबा मलेरिया ठारू सभिंको आमे बंचाइबा मलेरिया ठारू सभिंको आमे बंचाइबा चलो सभी मिसी करिबा आमे निश्चय मलेरिया मुक्त समाज गठन एवं आम प्रयास मलेरिया मुक्त समाज गठन एवं आम प्रयास धन्यवाद।